Hey everyone, this is Bill Russell here, and I'm excited to introduce you to our newest show, This Week Health Live. Join me and my co-hosts Drexta Ford and Sarah Richardson every week as we dive into the latest in health IT with a blend of humor, personal stories, and expert analysis. We'll bring you engaging discussions and a few surprises along the way, and it's all live. It's on LinkedIn Live, YouTube Live, and it will be on our website as well, thisweekhealth.com. Don't miss out on our pilot episode on June 7th at 1 p.m. Eastern Time, where you can join in on the fun with comments and questions, live polls, and more. We'll see. But don't worry if you miss out. Each live episode will be recorded and released on our news podcast channel the following week, so you can catch up on all the action then. Don't miss out. Subscribe now at thisweekhealth.com so you know when you can join in making health IT informative, entertaining, and fun. Don't miss out. Tune in and be a part of the conversation. Today in Health IT, Epic releases open source AI validation tool for health systems. Today we discuss. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, a set of channels and events dedicated to transform healthcare one connection at a time. We want to thank our show sponsors who are investing in developing the next generation of health leaders, notable ServiceNow, Enterprise Health, Parlance, Certify Health, and Panda Health. Check them out at thisweekhealth.com/today. All right. Hey, this news story, by the way, and any news story we covered, you can find on thisweekhealth.com/news. You can also subscribe to get that delivered to your inbox every morning. And finally, share this podcast with a friend or colleague. Use it as a foundation for weekly discussions on the topics that are relevant to you in the industry. They can subscribe wherever you listen to podcasts. This is a form of mentoring. All right, let's take a look at what's going on here. So finding this story from Fierce Healthcare, Heather Landy. Epic launched an open source tool on Wednesday to enable healthcare organizations to test and monitor artificial intelligence models. The AI validation software suite is free and available to the public on GitHub. Corey Miller, Vice President of Research and Development at Epic, told Fierce Healthcare health systems can download the code to their electronic health record systems. He said health systems can use the tool to validate AI models to integrate with EHR systems, including models developed by Epic, as well as other models developed by other organizations. As AI best practices are developed, the open source framework will enable organizations to bring in those standards and practices alongside the AI validation capabilities, Epic executives said. Miller said it marks Epic's first open source tool. That is one of the things I was going to highlight here. This is a departure and a welcome departure that we now have this code out there. It was really necessary. It was really needed. And it'll be interesting to see where this can be utilized. I would assume it can be used with other EHRs. We'll keep going here. By publishing on GitHub, it's truly available to everyone. It's not behind any lock and key that we control. We're excited to dive into this world. It's fitting that a tool intended to ensure that equity of health AI is going to be publicly available and open to contributors from around the globe. And it is exciting and interesting. In early April, EHR Giant announced plans to release AI validation software, which they have. The AI software suite that Epic calls an AI trust and assurance software suite automates data collection and mapping to provide near real-time metrics and analysis on AI models. Seth Hain, Epic's Senior Vice President of R&D, said back in April, wow, didn't read that correctly. You can tell it was a long weekend. I'm having trouble reading my text in front of me. The automation creates consistency and eliminates the need for healthcare organizations, data scientists to do their own data mapping, the most time-consuming aspect of validation. It goes on to talk about the Health AI partnership, a collaboration of organizations including Duke Health, Mayo Clinic, Kaiser Permanente creates and disseminates best practices for AI product use in healthcare to sites. Duke and University of Wisconsin Health will use Epic's AI trust and assurance software suite to conduct a study to generate evidence around use of the tools to locally test and monitor AI models. And so a lot of exciting things in this article. You can check it out. I did not cover the whole article. Let me give you my so what on this. My so what on this is open source tool, fantastic. Good on you, Epic. Appreciate you heading in this direction. The second thing is, love the health systems that are putting this to use. What are they going to be putting it to use for? It's that they can look at, provide some visibility into the system and the model try to ensure fairness across different patient demographics. One of the things that we've talked about on the show, I remember talking with Stanford, Mike Pfeffer, about this. He was talking about the value of their data. He said, because these national models aren't necessarily relevant to their populations. And this is the kind of tool that's going to be able to help you to evaluate, is this tool giving you the right results for your local population? Really like the direction here. If you are looking at equity in your AI tools, if you have an AI governance group set up, which I recommended a while back with regard to this, I think that's one of the biggest steps going here, is having a group of people, a named group of people within your health system that is looking at all of these things as they emerge. They're looking at the use cases. They're looking at what's required from a literacy and an adoption standpoint. They're looking at policy and governance. They're looking at use cases and evaluating those use cases around AI. And so I think it's important to have that named group that is looking at all those various things, and then obviously also looking at equity. And this tool is one of those that group would look at and say, hey, look, this gives us ideas for how we are going to measure, how we are going to report out on the equity of our models. And they can begin to work with IT and others to validate the model and test it out and see how it works and get it working in your environment. So a lot of good things here, a lot of exciting things here. And take a look. Give me some feedback. Let me know how it's working in the real world. Love to hear from you on that. All right, that's all for today. Don't forget, share this podcast with a friend or colleague and use it as foundation for mentoring. See how hard it is to come back from a holiday week, but it was a great holiday week and needed. So I will get back into the flow of things. It's all good. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders. Notable: ServiceNow, Enterprise Health, Parlance, Certify Health, and Panda Health. Check them out at thisweekhealth.com/today. Thanks for listening. That's all for now.